yourself and what made you choose this profession as a midwife?
Sure. It's an interesting story. So I'd never heard of midwifery growing up. My siblings and I were all delivered by the same family doctor for my mom. And when I was in university, I took a course where we watched The Business of Being Born, Sociology of Gender and Health at McGill. And once I watched that, I realized midwifery was actually part of the healthcare system, in the US at least. And then I worked in global health and public health. And I was working for the World Health Organization in Geneva, and I met a midwife there, and I started to meet many midwives there, and I realized that I could work in that area with having a clinical specialty. And I loved moms and babies so much, I realized actually midwifery would probably be a perfect fit. And then after leaving Geneva, I came back and realized there was a program at UBC in the Faculty of Medicine, so I applied, and here I am today.
What job as a midwife entail?
So it entails many different things. Maybe I'll just kind of start off by explaining the principles of midwifery. Midwifery entails continuity of care, so it's important for us that our clients get to know us through their whole pregnancy, so that they know the person who's going to be there during the birth with them, and then be caring for them in the postpartum. We talk to our clients so much about all the different options that they have during pregnancy and birth, so that they feel like they're getting all the research and information they need to make the decisions that are right for their family. We also work as an integrated part of the healthcare system, so we work with our colleagues, obstetricians, family doctors, different physician specialists, nurse practitioners, nurses, to be able to provide excellent care for our clients, and for whenever they need something outside of the midwifery scope, we're able to organize that for them. We also provide choice of birthplace, as you know. The thing about midwifery, we provide evidence-based care, so we often are looking at the research and offering choices to our clients that are new with the best available research. And we can also be primary care providers, so it means that we are the person who's basically organizing care for our client through their pregnancy, birth, and postpartum. And that even though we do need to consult an obstetrician in pregnancy or in birth, that we still remain with our client and we do their care, or they don't transfer care from us. With that being what the principles of midwifery are all about, like family-centered, woman-centered care. As a midwife, what my job is to provide care for women in clinic. So I meet them through their pregnancy, or I'm seeing them in the postpartum. And then when I'm not in clinic, I'm on call, so I'll be carrying my pager. And whenever someone pages me, we're available 24 hours a day, 7 days a week on our teams. So if I get a call from a client, if it's just questions, I'm there to support them and give them the information they need. Or if they're ever concerned about their pregnancy, their baby, or if they're going into labor, they're paging me to come assist them and be there for them.
What are the benefits of having a natural birth?
Like a vaginal birth versus a C-section?
Yeah, so that, and also
like
without
no epidural vaginal delivery over C-section. I would say that the benefits are usually the recovery is quite a lot quicker. Again, there can be other complications that could change the situation, but in general, the recovery for vaginal delivery for a woman feeling pretty back to normal, about a week, whereas after a C-section it can take quite a few weeks. It is full abdominal surgery. Another thing too is that they have done some studies to show, and like done systematic reviews where they look at a whole bunch of studies and combine all that data. And they have seen that there can be increased rates of a few things associated with C-section, such as childhood asthma in a baby, obesity, a few things like that. That research is a lot newer and not incredibly concrete. And with regards to just what I've seen as a provider, I would say that there truly is something to be said about the way that you see a woman react once she's delivered her baby, when she has an epidural or not, during a C-section or not. And sometimes a C-section and sometimes an epidural are truly really a good idea at certain times, and when they're medically indicated, it makes a lot of sense. But going back to that interaction I've seen, there's something about when all of your natural hormones and all of your endorphins are bringing you to that point where your baby comes out into your arms, and the reaction you see a woman have is so intense. Epidurals, they actually don't necessarily, by the research, increase rates of C-section or anything like that, but they can lead to a longer labor, longer pushing, and that can lead to complications of the room.
Okay, so what are the benefits of a home birth?
Why we offer home birth, and some of that is in the benefit. We know from 2 main studies that have been done in Canada is that home birth is a safe option in areas of Canada or areas of BC where it's well integrated into the system, and there are trained care providers to offer it. 2 main studies. One has come out of McMaster. The principal author is Eileen Hutton, she's a famous midwife in Canada, and the other study is by Patty Jansen, a famous researcher at UBC that I used to work for, so I'm very familiar with her work. And basically that data that they collected and they analyzed showed in both settings that outcomes for babies were the same for planned home births and planned hospital births. So basically if someone started their home birth at home but they needed to transfer in for any reason, they were kept in the home birth category, and then births that were planned in the hospital and happened in the hospital were of that category. So they compared the 2 groups, and they also compared those births being among midwifery clients. And what they did find was that outcomes for babies were the same, whether they were the planned home birth or planned hospital group. Statistically, there was no difference in outcomes, and that included like outcomes of the babies needing a lot of help breathing, outcomes of babies passing away, those kinds of serious outcomes. Women who planned home births had lower rates of intervention, whether that's epidural, oxytocin, C-section, assisted vaginal delivery, like forceps and vacuum. Women had a bit shorter labors, and that also women had lower rates of infection, because when you're at home, you're in all of your own bacteria as opposed to other people's bacteria in the hospital. The other thing to mention though is that these studies were also looking at women who were healthy, had low risk pregnancies, or low risk to begin with. So it's important when you're deciding on choice of birthplace, what's right for your family, that you're considering everything about what kind of candidate you are for a home birth. And that makes you a really good candidate for a home birth often is being a second-time mom with a history of having your baby vaginally. Often once the baby's way has been paved before, then with a second baby, it's usually quite straightforward. So we know that moms who have had a baby vaginally before have much lower rates of transfer from home to hospital. And again, most of those rates of transfer then are with first-time moms, and the most often reason that they transfer in is for pain management. And then the second most often reason that they transfer in is because their labor isn't progressing. Maybe their baby's in a not great position, they might need a little bit of oxytocin to get their contractions stronger, to move their baby around a little bit and get in a better position.
Makes sense.
We've kind of got our guidelines of how often we assess a woman's cervix and labor, but we also know that the more often we're checking, that it does increase rates of infection if you have over 8 checks in labor. And it depends on a few other things too. How long a woman's water has been broken for. Like for you, your water was broken for a long time, so we really wouldn't have wanted to be doing checks. Something to be said about letting a woman just do her thing, whether it's in the home or at hospital, in the hospital. And we can truly see as midwives and as maternity care providers, we can watch a woman progress. And there's a lot of signs that women give us without us even having to touch her cervix, that we can hear over the phone or see in person, that really tell us there's excellent progression of their labor and mean that we don't feel like we need to intervene, and we're like checking for those other things as well. Another thing, going back to, you're asking about like then safety of home birth and other people feeling like hospital birth is a more safe place. Truly what we see as midwives is the safest place for a woman to give birth is where she feels most comfortable and most safe. And for some women, that's not the hospital, that's home. Maybe they've had a traumatic experience in the past in a hospital that puts them at a little like heightened sense of fear when they're in the hospital, and that's understandable. For some women, they're not going to feel comfortable at home, maybe because their family is not supportive of them having a home birth, or their partner isn't supportive. And if everybody's on edge and people aren't calm and feeling secure in that setting,
Yeah.
it's not going to help your labor progress. Labor it does kind of have some of the hormones of truly like an orgasm.
Yeah.
And when you think about if you were trying to have an orgasm in a place you didn't feel comfortable, it's not going to happen.
Yeah.
You're not going to be able to feel calm and relaxed. And it's the same with progression of labor.
Yeah.
If you're in a place that doesn't make you feel secure, you're not going to have that steady progression. But often, truly people do feel that in their own space, in their own home.
Yeah.
Carry actually the amount of equipment of a level 1 hospital in British Columbia that provides maternity care services. So if you can imagine what the labor and delivery room looks like in Haida Gwaii, everything in that room is in the trunk of my car right now.
Oh, wow.
Yeah, so it's a lot. We've got a lot of bags that we carry out for safety so that we can deal with any emergencies that happen at home while we're making sure that our clients are stable while we're transferring into the hospital. And we also have 2 midwives at every home birth, in the same way that in every hospital birth there are 2 care providers as well. The midwife or the family doctor or the obstetrician and a nurse as well. Basically the reason we have 2, so we've got a care provider for each patient. So we've got a care provider for mom and care provider for baby once the baby is born.
The benefits